Following on from the ACORN standards, I looked at the research in the area of nurses' compliance to personal protective equipment and surgical attire. The National Health and Medical Research Council states that there have been limited controlled clinical studies assessing the relationship between the use of personal protective equipment and the risk of hospital-acquired infections. They go on to quote Pratt et al. And Clark et al. Saying that, however, the use of barriers reduces opportunities for transmission of infectious agents. Neo, Edward and Mills in 2012 conducted a review of the literature on the use of personal protective equipment by nurses in the operating room and discovered that quantitative studies had found suboptimal compliance rates. Research has shown that staff that perceive surgery to be lower risk are more inclined to use their personal glasses as personal protective equipment or wear their protective eyewear on top of their heads like sunglasses are sometimes worn. What is stopping nurses being compliant? Nurses' attitudes towards patients, knowledge of personal protective equipment and its usage times, peer pressure, accessibility to personal protective equipment, previous occupational exposures, and behaviour of nurse leaders are all influencing factors on why nurses are not compliant with wearing personal protective equipment. What improves compliance? It has been discovered that nurses were more compliant with wearing personal protective equipment due to a number of factors. Nursing leaders who were knowledgeable, dedicated, friendly, managerial and skillful influenced a culture of safety amongst the staff that they led. Education, resource availability and delivery by those respected in the area of personal protection, such as infection control nurses. The availability of personal protective equipment being placed where staff can get their hands on it quickly when it's required. And personal protective equipment needed to fit well and not hinder work practices. For example, gloves fitting properly and eyewear not obscuring vision. In 2013, Neo, Mills and Edward undertook their own research on Australian nurses about wearing eye protection in the operating theatre. They found that with accountability comes a need to comply with personal protective equipment such as eyewear. Having access to employers' policies on personal protective equipment, ACORN standards and the National Safety and Healthcare Quality and Service Standards can improve compliances as nurses are better informed.